guys, Amanda here. I'm going to do a two-part update video on what I take for vitamins and meds. I'm going to go as fast as I possibly can. I'm going to start, this first video is going to be what I take for prescription medicine. I'm going to start out with my inhalers. I take 3. One is a nebulizer, and I take that as needed. When it's winter time, I take it when it's extremely cold and I have a hard time breathing. And in the summer when it's extremely humid and I have a hard time breathing. And I have, and when I have asthma attacks, severe. I also take daily Pro Air. This is what it looks like. And let's see, inhale 1 to 2 puffs 4 times a day if needed. Proventil HFA 90 mcg inhaler. And this other one that I take is Advair 250/50. That's the strength. Let's see. Inhale 1 puff twice a day. And this is what it looks like. I'm sure you've seen it on TV or wherever. Okay, next is, this is women's stuff, birth control pills. I take this right here. I'm gonna include it in something that isn't prescribed, but they go hand in hand, okay? Alright, now, I learned about this on the doctors. I'm not telling you to do it this way, I'm just telling you the way I do it. Now, as they explained on the show, if you have like an average 28-day container like I do, you take the first 3 weeks, and then this week is like a break week or something. There's no medicine in this. It's actually a waste of space. But what happens when you do that is you're taking these, most women are taking these to prevent pregnancy. Now, if you're trying to prevent pregnancy, you take these, right? But wouldn't you think that continuing it would make sense if you're trying to not get pregnant? When you put all this medicine in your body, okay, to not get pregnant, and then suddenly you have a week where you don't take it, you're going to be more susceptible to getting pregnant. That makes no sense. So what they suggested, and they said a lot of women in this profession do it this way, but they don't tell their patients to do it this way. They tell them to do it the stupid way. So what I do, what they suggested is, after you get to your 3rd week, instead of taking these white pills, you start your next pack. So these don't exist, okay? You just take these and then start your next pack. What that does for me, I don't get periods, because when I get my period, it is terrible. It's crippling pain. It is just not something I want to deal with. This helps me, and I take these for pain in that area. That's what this is for. I am not currently sexually active, so this is what I take it for. Of course, if I am, I'll be covered, but in case I call my doctor. Oh, let me tell you this first. Take 1 tablet by mouth daily. I take it in the morning. It's called Momo-Linyah 28 tablet, also known as OrthoCyclen. So if I cannot, I get a 3-month supply. So when those 3 months, when I start my 3rd refill, I call 2 weeks before I need to start the next pack, and I call for another prescription. And they can just, call it into the pharmacy. But say they didn't like this last time. I missed a week, and I'm going on my 2nd week now Yeah, today's Sunday, so this is my second week of not taking these because they didn't get to the pharmacy. So what do I do during that time? I wait until I have my cycle. I start the Sunday after, and I just continue that way. But in the meantime, I use these. One is for nighttime, one is for daytime. This one has caffeine, this one does not. I would take this in the morning, like during the day, and this one would be for bedtime because it does make me sleepy. Now, I just want you men to know, if you're still watching, don't let this label fool you, okay? It says for menstrual stuff, but it's just a marketing strategy to target women to buy this stuff, okay? So don't be fooled by this label. Look at the uses on this medication, okay? Men and women can use this. Uses: bloating, backache, water weight gain, breast tenderness, cramps, headache, muscle aches, fatigue. Okay? Pretty much everything that I just said, except maybe the breast tenderness and the cramps, everyone gets. Men, women, doesn't matter. Okay? It's the use that's important, not the picture on the front, okay? So just, if you're watching, just remember that, okay? And share it with your friends, whatever. Don't be like, oh my god, it's a women's medication. It's what it's used for that matters. Oh. This is what the pill, this is the nighttime one. Has numbers on it, and I think the other one looks the same. Yeah, it looks the same. So don't get them mixed up because they are both white pills. Okay, so I just did those two because it went with the birth control. Those aren't prescribed. Alright, now I'm going to go on to my pain medications. I take cyclobenzaprine, also known as Flexeril, 21 milligrams. Take 1 tablet by mouth at bedtime. And I can always cut that in half, but I take that to help relax my muscles because I can get really tight in my back, and it really helps. And this is what it looks like. I also take Methadone, also known as Dolafine. Take 1 tablet by mouth twice a day. And this is a 10 milligram pill. This is what it looks like, and as you can see, there's like, okay, oh, that score mark right there, okay, you can break it in half, which is what I do. Now, this is 5, this is 5. I can take one in the morning, one at night, and then I still have a whole nother pill that I can work with if I need to. And that really helps, especially with my foot. Okay, now, I also take Gabapentin, also known as Neurontin. Take 3 capsules by mouth 3 times a day, 300 milligram capsules. So, now depending on the strength you have, the pills will look either bigger, smaller, and probably a different color. So this is what it looks like. This is just one. I take 3 of these at a time, up to 3 times a day. I try to stick to 2 times a day, morning and bed, but if I need to, I have 3 more pills I can play with. Now, this medication, well, also has dual purposes, such as a mild mood stabilizer. So I'm going to segue from that into my actual mood stabilizer, which is Lamictal. Now, I take 225 milligrams a day. And I don't have my other one, but this is what the 25 looks like. The 200 looks exactly the same. It's just bigger and it's blue. Now, I split them up. I take the 25 at night and the 200 during the day, because if I take the whole thing in the morning, it makes me really tired for some reason. So I split them up, and it works best like that for me. And having that mood stabilizer in conjunction with the Gabapentin, Since this one works as a mild mood stabilizer, it contributes with the Lamictal, so it works together, which is good. I also take Lorazepam, also known as Ativan. Take 1 tablet by mouth once daily if needed for anxiety. 0.5 milligram tablets. So it's usually a whole one, but I cut them in half. You can see it's like half a moon. So this is 0.25, and I try to take that when I know I'm going to be in a serious situation that I know is going to be like, you know, but I really try hard to not use these in stressful situations and learn how to do it without it. I don't want it to be a crutch at all. So this last medication that I take as a prescription medication is amitriptyline. Take 1 to 2 tablets by mouth at bedtime. I take 2 because, you know, it helps me to sleep better. It's 50 milligrams, and this is what the pill looks like right here. It's like a red color, like a brick red color. I don't remember if I said it. It's also known as Elavil, if I didn't say that before. Okay, so that is what I take for prescription medication slash this over-the-counter stuff. Alright, that's the end of this one, and the next one will be part 2 of the vitamins and supplements. Thanks for watching. Bye. To be continued.